Hi, my name's Adam Coldwells. I'm the Chief Officer of Aberdeenshire Health and Social Care Partnership, and thank you very much for taking the time to look at this video. The Aberdeenshire Health and Social Care Partnership was formed back in 2016, and we've made some great progress over the last few years, enabling members of NHS Grampian and Aberdeenshire Council to come together in the Integration Joint Board to allow the planning and the delivery of pretty much all the services that aren't delivered at Forester Hill to be delivered through the Aberdeenshire Health and Social Care Partnership. And that spans all of our health provision as well as those services that used to be run by the council through social work, care homes, care at home, and that huge number of things that we deliver for people every day in the community. What we're very keen to do is to be able to make joined up decisions across Aberdeenshire. And one of the key tools we need to be able to do that is to have a strategic plan that describes what we think is really, really important, and it sets out how we're going to do that over the next 5-year period. This gives us a real target and a goal to set at and to see how we organise ourselves and prioritise services. It'll be important that this strategic plan has really good engagement from you, our staff and the public, so that when we come in the future to look at what we're going to do and how we're going to deliver it, we have this framework to make our decisions against. And the more involvement and engagement we can get from you, the better and more robust that service and that plan will be and those services will be for us to deliver. Through our experience and the government drives and various things that we've picked up nationally, we're aware that we need to have a number of priorities. And in Aberdeenshire, through the Integration Joint Board, we've set out 5 priorities. And I'm just going to tell you very briefly about each of those priorities. The first one is the idea of prevention and early intervention. And that does very much what it says on the tin. It allows people to look after themselves, to prevent becoming ill, and therefore we avoid disease and poor health. And that's a really great place for us to get to. The second one is the idea of reshaping care. And this is us trying to think about how do we work with people that need support from us, and how do we deliver the care differently and in a sustainable way for the long-term future. So that might be care in your own home, or in a care home, or in a sheltered housing, or through our community hospitals, or any of the myriad of things that we deliver. The third priority is about engagement, and we want on an ongoing basis to have really, really strong engagement from the public, from our communities, and from our staff members. And this is one example of us trying to engage with you, whoever you are watching this video. The fourth priority is the idea of the effective use of resources. Obviously, we're spending taxpayers' money on the number of services that we deliver, and we spend a huge amount of money, about £300 million a year. And so it's very, very important that as we have really tight resource envelope, that we use those resources as well as we possibly can. So a key priority for us to do and to work with you about how we do that. And our final priority is the idea of tackling inequalities and of public protection. And this is really fundamental to everything we do in all of our services. We need to try and reduce the inequalities that people suffer broadly because of where they're born and how they've grown up. And the more we can do that, the absolutely better our communities will be in the future. So, on to how we're going to do this. So mine is by way just a short, brief introduction, and we've then got a number of videos that set out a few key points that we want you to think about against each of those 5 priorities that I've just explained. Alongside that, we have a survey, and we'd be really grateful if you could fill that in. And I know a number of people are completing these sessions in small groups that you're leading yourselves, which is really fantastic. We're really pleased with that and hope they go really well. So you can pick and mix and match with the videos that are on this system, and it'd be great to hear back and get your feedback on what you think is important and what you'd like us to concentrate on as an Integration Joint Board for the delivery through the Health and Social Care Partnership. So, My final comment is please have fun while you do it, and we really look forward to your feedback. And once we get all of your feedback, we will then come back to you, be it your members of the public or communities or our staff members, to let you know what you've told us and what we're going to do with that. My thanks to you all, and this is Adam Coldwells saying goodbye.